right, good morning everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. And today we're talking about depression again in our series, and we're talking about it relative to glutamate, an excitatory neurotransmitter, and we're joined by Kathy. Kathy, good morning.
Good morning, everyone.
Yeah. And any thoughts on this, Kathy, before we get rocking and rolling?
Well, can we kind of recap just a small portion of what we did last week to kind of tie the two together?
Yeah, absolutely. So in reviewing what happens in the brain with depression, we've talked about it for a long time. There are many factors, and I'm just going to kind of tilt the camera this way. I think that's better. Actually, I'll bring it closer too. I think that'll be good. So with depression, we've talked about it for a long time. There's a structural imbalance between the fear center and the memory area. Why is that important? Because when the fear center hyperactivates, that's been shown in patients with depression, and when that occurs, then the fear center literally grows into the memory area. As a result, the fear center fires to your hypothalamus right in this region. Hopefully that shows up. And then the pituitary gets activated, and that sends signals to your adrenal glands, where then we have really high levels of cortisol. That's going to be important to today's discussion. And high cortisol, which is not going to show up based on this marker, so I'll draw it with a different pen. High cortisol feeds back, and it damages many areas of the brain, but particularly it seems to preferentially affect the prefrontal cortex as well as the memory area. Now, in last week's discussion, we talked about how genetic abnormalities or genetic polymorphisms can affect our ability to make chemicals. As Kathy and I are frequently saying, we're talking about how people say, well, depression and anxiety, these are chemical problems in the brain. They are, but they aren't. And the chemical problem, so to speak, puts a misnomer on it or a pejorative connotation to where it makes people feel bad. And people shouldn't feel bad about things like depression and anxiety because they're already feeling bad enough. So Kathy and I discussed how genetic tendencies, so to speak, can affect someone's ability to make or process serotonin, dopamine, and norepinephrine, to where these chemicals are vital, or these neurotransmitters are vital for making new brain cells in that memory area. These neurotransmitters are the pivotal thing that opposes the fear center from overgrowing into the memory area, and that's what leads to the hypercortisolism, and that's what leads to a lot of the symptoms of what people experience as depression. So that's kind of the summary of what's been going on. But today we're going to talk about glutamate, because glutamate is the primary excitatory neurotransmitter in the brain. And this excitatory neurotransmitter can overexcite our brain cells to where then we can start to feel depressed. So Kathy, any comments before we go further?
No, I'm just excited to see how this goes and what this does, because just the word excitatory, it just puts up a red flag for me. So I know it's going to do something, and it's going to be impactful.
Right.
So tell us the story.
Okay. And if everybody on Facebook can just let us know that they can hear us well. We had one listener saying they couldn't hear. So anyways, give us some feedback.
It was a little weak when you went to the whiteboard a minute ago.
It did? Okay. Okay. Gotcha.
Yeah.
Okay. So let's say it this way. A lot of what we've discovered with depression and anxiety has been based on different medications used throughout the years for different conditions. And as a result, then people started noticing that their depression went away. For example, relative to glutamate, there is I think it's called L-cycloserine, was a medication used for tuberculosis back in the 50s, and they actually found that it helped with depression. And they later realized that it affected glutamate metabolism, and they're actually circling back to this medication to see if it will help people with depression. There's a medication called ketamine, which can be used as like an anesthesia type drug. But ketamine is gaining a lot of popularity in today's world because it helps people with chronic pain. So they're using ketamine infusions for people who have horrible pain syndromes. It's also being used for depression. And what they find is that ketamine affects glutamate instantaneously. And what's different about ketamine from your standard antidepressants like Prozac or Wellbutrin or something like Cymbalta is that it works instantaneously, whereas those drugs are slow to act. So ketamine is referred to as a rapid-acting antidepressant versus the other ones are slow-acting antidepressants. So
they almost have to build up in your system for a couple of weeks, don't they?
Yeah, and that's what everybody says. And really what those medications are doing is that they're fostering more of these neurotransmitters depending on which med we're talking about. Something like Prozac is going to affect more serotonin. Something like Cymbalta is going to affect serotonin and norepinephrine. Wellbutrin is going to affect dopamine preferentially. But as you increase those neurotransmitters, then we're going to grow new brain cells or have a proclivity to grow new brain cells in the memory area, which is why it takes 2 weeks. So that's the perfect point, Kathy. So thank you. Whereas the ketamine...
When you turned to the whiteboard again, it sounded like you were down in a well. So
oh, really?
turn
Okay.
Your head or speak
okay,
a little
gotcha.
louder.
All right, so I'll just scoot off to the side and I'll point to the whiteboard. So basically, those drugs like Wellbutrin improves dopamine. Cymbalta improves norepinephrine and serotonin, whereas Prozac improves serotonin levels preferentially. And when you get these neurotransmitters higher in the brain, you're going to grow more new brain cells in the memory area, which opposes the fear center, a la the diagram right there. Now, something like ketamine is going to affect glutamate instantaneously. And they find that they can infuse ketamine into somebody with depression who has really, like treatment-resistant depression. Lots of times, it will bring them totally out of it. And they go and they look at their brain, they look at metabolites of the brain, and they realize that brain-derived neurotrophic factor, BDNF, goes up almost instantaneously, and they feel better right away. And the question is, well, how does this work right away? Whereas the standard medications take 2 to 4 weeks to take effect. So that's what we're going to talk about today. And we're going to talk about how glutamate can overexcite your brain cells and be a problem. So any other thoughts on that, Kathy, before I go specifically
Well,
into
since
that?
you mentioned the ketamine, and I know I'd heard of it for, like you said, for pain.
Right.
And it's a very familiar drug right now. I was wondering, you had a patient last year who flew over from the Mediterranean that you worked with that had that depression that he was so depressed, even his mother passed away and he had no feeling for it or whatever.
Right.
Was this something, did they try ketamine on what he was dealing with?
I can't remember. I can't remember specifically in that case. And we did do a radio show for everybody who wants to listen to that. We did a radio show with this patient. He was really kind to divulge his story, for the sake of learning. But I don't think he did. And I don't think that was really available in the country that he was in. Whereas like ketamine's just being used now in the US, kind of off-label, kind of as an experimental type treatment for treatment-resistant depression, but they're seeing really exciting results. So that's my story. Now, I will say there's also a lot of discussion on some natural amino acids that are thought to do the same thing. Maybe not as instantaneously effective, but they work similarly and are producing structural changes in the brain. So that's very exciting too. So glutamate. So this is a brain cell, this is a brain cell. So glutamate is going to be in this like little water balloon type structure here. And when this brain cell is trying to excite this brain cell, it's going to send the water balloon down to this area of the neuron. It's going to exocytose. So basically the glutamate is going to be vomited out into the synaptic cleft. And then out here, it can bind to the glutamate receptors. This is how this neuron gets activated. When we have neurons that are activated, then our brain is functioning and we're able to think and we're happening, so to speak. Now, when there are high levels of cortisol, back there, you can see the high level of cortisol. When that is up, they've actually shown that the Astroglia, so we'll just call them glia for the sake out here. This is an Astroglia. It recycles the glutamate. And so if you have high levels of cortisol in your prefrontal cortex, the astroglia are thought to not recycle the glutamate appropriately. And what they find is that eventually you won't have as much glutamate in this neuron. And so there's a less of it. And the thought process too is that somewhere in the event, not of acute stress, but chronic stress, that this glutamate overexcites this nerve down here, and eventually the astroglia kind of stop functioning right. And then we have a lack of glutamate signaling in the brain, particularly in the prefrontal cortex and the memory area. Whereas other areas like the fear center and your dopamine producing area called the nucleus accumbens, they upregulate when there's chronic stress. So it's very, very interesting how complicated depression can be. And I'm summarizing a pretty complicated topic because there are many nuances to this, but in essence, that is the summary that everybody's agreeing on at this point in time, that chronic stress affects the glia out here, how they process glutamate. The net sum is that this nerve down here got overexcited. It's like it burned itself out. Same with this guy, and then there's less glutamate to activate these neurons. So when you give somebody something like ketamine, the ketamine causes it binds to these receptors. They're called NMDA receptors. And when it does that, it causes a release of glutamate, and then it's like it jumpstarts the system. Kind of like if you put paddles on somebody's heart and you shock them. It seems that the ketamine does something very similarly. Any thoughts on that, Kathy? Does that make sense?
I think for me, I just went, wow, that's a really big deal in this field, because we talk about clinical depression, and when people are in that, what I always say, you can't see the forest for the trees, because when the person's inside that, they can't see any way out, and people talk about feeling like they're mired down. They can't, just the depression makes them so exhausted. And they have no hope, no thought of ever, and absolutely no way of thinking how they can change this circumstance. So if ketamine can chemically do that quickly, that's a big deal.
It really is. Yeah.
I mean, someone can go to a therapist, no matter what kind of therapist, for months and years, and not get that kind of effect. They might find some other answers that they're looking for, but that's not going to chemically bring them out, which everything you just talked about was all a very chemical situation.
Right.
So, yeah, I think this is huge.
It's absolutely huge. And that brings up, I always love your perspective, Kathy, because there are gradients. There are individuals who are depressed who haven't responded to medications, for example, that then we work with using natural supplements, and they have great results. But let's all keep in mind, too, there are patients with severe treatment-resistant depression that have tried supplementation and dietary changes. They've tried every medication, and it's not working. So in someone like that, if ketamine can step in or be administered and have this type of an effect, wonderful, because that can be life-changing for that individual, and then maybe they'll start to respond to other natural therapies that they didn't before, because the ketamine upregulated all these neurotransmitter responses. So yeah, it's a really, really great discovery. And
you would think that would be an end result if the ketamine, like you said, got everything back to, as we always talk about, being in balance and to natural levels, or to the desired levels for that. Then yes, it would seem that the body be more receptive to the natural supplements for the other stuff they're going through then.
Right, you would think so. And we had the question posed, so what is treatment-resistant depression? Usually that's when somebody has tried at least 2 antidepressants, and I think it's for a period of longer than 18 months, and they're not responding. So there are different criteria for that, but that's the one that I've seen referenced the most. So if you've been on many antidepressants and you're still depressed, that would be it. If you haven't been on an antidepressant, then you technically can't say that you have treatment-resistant depression, according to the criteria, the way I understand it.
And we do
you could correct me on that, but that's what I read in the literature.
Right. The commercial on TV, at least one of those were, okay, if your medication's not getting you the results you need, then they add another one. They find they have better results with the two mixed together or whatever.
Right,
so yeah,
right.
I mean, people need to be aware that just because you're taking that medication does not mean it's the magic pill and all of a sudden you're going to feel better. So,
Right,
yeah.
true.
And the gentleman that we saw from the Mediterranean was pretty much in that boat. Nothing was working for him.
Yeah, right, exactly. Yeah, a lot of individuals try 7, 8, 10 different antidepressants. And kind of something we were highlighting the last couple of weeks is that with what's referred to as, I believe they call it psychopharmacology, and there's a genetic component to that word. Basically looking at somebody's genetics to determine which medication would be best for them, because we can now classify, do you have the serotonin transport protein polymorphism that would allow you to respond to an SSRI, serotonin specific reuptake inhibitor, or do you not break down adrenaline well, do you have a COMT polymorphism? All these genetics can now be looked at when a doctor's recommending a supplement or a medication. So that's really big. And one thing that Kathy and I were discussing is that this glutamate issue seems to be pertinent to not only depression, but is pertinent to anxiety, obsessive compulsive disorder, bipolar disorder, and schizophrenia. So one thing we see across many of these disorders are volumetric changes in the brain tissue. So with depression, we talked about it a lot, this memory area seems to lose volume. Other areas of the prefrontal cortex can also lose volume. With schizophrenia, we talked about it relative to gluten, that years before schizophrenia comes on, they can see in the brain, and I'm holding up the brain model, that the dorsolateral prefrontal cortex out here is atrophied, more in this region. The dorsolateral prefrontal cortex is atrophied in individuals years before they're going to develop schizophrenia, because those neurons almost are like burning themselves out. And Kathy and I were talking about in that broadcast, upwards of 30% of individuals with schizophrenia have gluten antibodies. And these gluten antibodies not only are floating around the bloodstream, but actually pass into the brain. Whereas other individuals with gluten antibodies don't seem to have the antibodies passing into the brain. Important detail. In this broadcast, Kathy, we had somebody ask, why don't US doctors acknowledge parasites? I can't say specifically, but on the topic of schizophrenia, a huge percentage of them, in fact, the vast majority, have Toxoplasma gondii. It's a parasite that lots of times comes from cat poop. It can be in ground beef. Most of us have been exposed to it, but individuals with schizophrenia do not seem to eliminate it from their digestive tract. This parasite has been shown to trigger gluten and dairy antibodies. So this is how nuanced it is. So now you take individuals with schizophrenia and they're making gluten antibodies, and they've actually shown that a portion of the gluten antibody binds to, guess what? The glutamate receptor, the NMDA receptor. So it's called GRINA. So all of you folks that love to research, look up GRINA and then a space, NMDA receptor. And you'll see that this GRINA component of the NMDA receptor is stimulated by these gluten antibodies in schizophrenic patients. Kind of interesting. So is that one potential mechanism why their brain cells overexcite themselves? Think of you're in your car and you're standing on the gas pedal and you're also standing on the brakes. So your wheels are spinning. That's what's thought to happen with the neurons, and that's why that we lose the density in these different areas of the brain. With me, Kathy, before I go on to the next point?
Yeah, you've basically, those tires spin so much you just burn it all off. You burn all the rubber off the tires, basically.
Right. Right.
And it's gone, and it's not coming back, right?
Basically, once the neurons are gone, it's difficult to get them to come back. Now, that's where something like BDNF comes in, because they are showing that if you can boost BDNF, ketamine is one way to do that, that you actually can grow back neuronal density. And when we see atrophy in the brain, so I'm going to turn away from the camera for a second, so the volume's going to go down. So let's see, up here, let's go like this, and then we have all these guys out here. Okay, so up at the top of the diagram, it looks like a sun with a bunch of fingers running out of the sun. So those fingers are called dendrites. That's actually not what they look like, but I'm just trying to draw it really quickly. And the dendrites, you can think of them just like hold your hands up like this and you have your fingers. Well, when we lose density in the brain, lots of times we lose portions of the dendrites. So it's like having little nubs for fingers rather than really long fingers. if you have high BDNF, you can actually promote dendritic growth. So to answer the question, yes, Kathy, we lose density, we lose neurons, but they actually, we're finding, can grow back in certain areas of the brain. Now, am I saying that there's a study showing that we can gain neurological tissue in patients with schizophrenia? I can't say that yet, but based on other research regarding ketamine, BDNF promotion, certain supplements, it is thought that we can grow back some of these dendrites. So that's pretty exciting. It's actually really exciting stuff.
Definitely.
Okay. So any thoughts on that?
Did we deal enough with the stress, how that affects the glutamate? We're done with that, or do we have anything else on that?
That's pretty much it. Basically, it really affects how the glia process the glutamate. And one thought process is with chronic stress is that it affects glutamate, particularly down in this region of the neuron. So not as much here, but down here. And so if you have excessive extracellular glutamate, then it's going to overexcite the neuron a little farther down the dendritic area or the bouton. So that's how it's thought to work. And then we're going to, go ahead.
Go ahead.
And then we're going to wrap up with vitamin D, right?
Right. Yes, that's where I was going.
Okay, cool. So vitamin D, we all know, can be associated with mental health. We all know that, or at least now we know, that in areas that have more of a gloomy climate in the winter, where there's not as much sunshine, there's not as much UV light coming through, that can affect our vitamin D levels, and that can affect our mental health in the wintertime. Commonly referred to as seasonal affective disorder. Seasonal affective disorder can affect individuals without depression. It can also affect individuals with depression and make their depression worse. So how does vitamin D affect the brain? They actually really don't know. They really don't know at this point in time. There's no consensus opinion as to why if you boost someone's vitamin D, all of a sudden they start to not feel as sad. And it's thought that vitamin D affects calcium metabolism. Well, we know that vitamin D affects calcium metabolism, but relative to this discussion, what I didn't highlight is that the NMDA receptor for glutamate primarily is known to affect calcium coming into the neuron. Certainly other what are referred to as cations, things like sodium, can come in when glutamate binds to a neuron, but calcium also comes in. What does vitamin D do? Vitamin D affects calcium metabolism. So it's thought that in some way vitamin D might be regulating NMDA receptors for glutamate. So it's all very, very, very interesting. And even like going back to ketamine, we used to think that ketamine blocked the NMDA receptor, but we're finding that in different concentrations, it can actually stimulate the NMDA receptor and stimulate this whole glutamate issue to kind of jumpstart the neurons. So that's the summary of the topic.
Okay.
Right.
Very good. I think
good.
I learned a lot this morning.
Okay, good. Awesome. Awesome. So I think it's good because we're kind of peeling this onion, so to speak. We've talked about stress relative to depression and anxiety, upregulates the fear center. We've talked about genetics and how that affects someone's ability to make norepinephrine, dopamine, and serotonin. We've talked about volumetric changes in the memory area and the prefrontal cortex. Now we're talking a little more specifically about glutamate and how glutamate can affect these areas, particularly in the circumstance of chronic stress, and how that then affects glutamate metabolism and certain agents that are affecting glutamate more than these guys over here. The reason why glutamate is also very exciting is because, as Kathy and I were discussing, glutamate pertains to schizophrenia and bipolar disorder and depression and OCD. And it's quite possible that in the future we're going to approach depression and all these different conditions from a glutamate perspective as much as anything, which may make unifying treatments easier. I'm not saying that that's going to be the case, but there is a lot of literature showing glutamate metabolism agents affecting all of those conditions. So that's where I'm excited.
Okay, me too.
Okay, cool. Well, thank you, Kathy. I appreciate it.
Okay, well, sounded good.
Okay.
Do we have any other questions from anyone?
Not that I'm seeing. We had a comment, there's no getting away from chronic stress or lifestyles are too much for any of us to handle. I don't disagree. And all the American lifestyle is very
that was
stressful.
where I was going to go for the last 2 minutes, was
right.
how important it is for us to find stress relief, because it's bad physically, mentally, and yes, at this day and age, I mean, 20 years ago, you maybe had a few people talking about all the stress they had, but now, I mean, from 10-year-olds up, everybody's under all this stress.
Right.
So whether they're learning to meditate, whether they exercise and work out more, whatever it is, it's probably a really good time for everybody to take a little self-inventory on that and kind of determine if they think they're feeling those effects, because, you know, if nothing else, it would be, what's the word, preventative. You know, to try to keep things on a more even keel and easier to cope with things, and not doing so much damage to your body and your mind.
100%. 100%. I don't know where we lost that in society. Well, probably because back in the day, people tend to work a more physical lifestyle. It was a more rural-based lifestyle, it seemed like. Certainly, we had the Industrial Revolution where people worked their tails off. But through a lot of human history, people were outside, people were walking, people were working. Now we're all inside. You know, we're stressed out from the time we wake up, because we wake up late and we drink our coffee and we rush to work, and then we got to go home and get the kids, we got to get dinner, and then we zone out because we're exhausted and we stay up too late watching programs, and then we do it all over again. And so certainly
you forgot traffic and our crummy boss and all the other factors. The kids all have to go to 3 different places after school, and all these different things that go on in everybody's life. So yes, it's much more demanding.
Right. Right.
I mean, if I was a farmer 100 years ago, I got outside and maybe I had a mule, maybe I had a horse, whatever, and I did what I had to do for the day, and it was hard work.
Right.
But at the end of the day, I got a meal and I went to sleep at 7 o'clock at night.
Right.
But I got up
Totally.
at 4. So, I mean, it is a different time, and a lot of the stress, as my husband says, sometimes we put it on ourselves, and we do. But at the same time, there are a lot of demands, and I think that's the word for it. And you know, Dr. Gates, I mean, what do you do on your lunch hour? You go work out.
I go work out.
You decompress.
100%. Yeah, I have
you
to.
do some meditation and stuff.
Right.
Just because you have a demanding job.
Yeah.
So, I mean, the idea of knowing that you need to do that to keep yourself centered is ideal. And I think that's the word. We need to work on being centered. And I think if we do that, we'll be able to find that we can handle that stress a whole lot better.
100%. And we got to be vigilant of it. And think of kids. What do kids do? They go out to recess. They go out and play. They burn off all of that energy. They take naps. You know, we've lost that. We're all going because we're trying to be more productive, burning ourselves out, just like glutamate does to our neurons. So yeah. And the last thing we had, do you recommend the genetic test for finding out what meds/supplements may be helpful? I do, and I also will say we treat people without the genetic testing just because we have a lot of experience in terms of what patients respond and what patients don't. And you can also say if this person doesn't respond to certain supplementation practices, then certainly I do look at the genetic testing. But you don't necessarily have to do that right out the gate. Now, in the medication world, that is being argued that we should be doing that because the medications are so complicated, and how the liver processes these different medications in different people can really affect why somebody takes Prozac and they feel great, and why other people take Prozac and, you know, they get suicidal thoughts. So that would be my answer there. Okay, so I think we probably got to get seeing patients, but thank you, Kathy, as always.
You're welcome.
Yeah. And I hope everybody has a great Wednesday. Send us your questions, and we'll go from there. All right.